Okay, thank you very much. We promised the university community that 2024 was going to be exciting for us. It has been very exciting. Since January 16, we started 24-hour care. In my earlier interactions, I had intimated that 24-hour care was going to come with some additional things. So 24-hour care has allowed us to do an inpatient care. We now detain patients here. We admit patients here for extended periods of time for both medical and surgical care. So far, we've attended to about 600 persons, admitted and discharged 600 persons. Most of our cases have gone home very, very well. We have had very little cause to refer. A few cases have been referred. We've had 1 or 2 mortalities. Unfortunate as it is, but this is healthcare, and so these are the natural outcomes you would expect. Regarding surgeries, we started with the basic surgeries, and that I am happy to say that we have moved on. We've done a few in quotes complex surgeries right here at the University Health Services. So we've made a lot of progress, very significant progress. As I speak to you now, our surgical case count for major cases stand at about 85, nearing 90. Come Friday, when we do another set of 5 or 6, we'll be hitting our 90th surgery. We've done some minor surgeries too, but those ones we don't usually count them, and so it's the major surgeries that we book that we count. Significant among the major surgeries we've done an ectopic surgery for one of our clients here, students here. We have also done as for the fibroids of reserved numerous, but we have done perforated peptic ulcer surgery for somebody right here at the university clinic. We've done ovarian cystectomy surgeries for other persons. As for hernia, I'm sure, as the VC said, Dr. Hernia, we are capturing hernia everywhere. So yes, the progress we have made has been phenomenal. We thank the management of the university for the support. I thank sincerely my able staff, especially those who help us out in the theater. I thank everybody. We thank the university for the patronage. We thank the surrounding communities for the trust and confidence they have in us. There are challenges that have come with this 24-hour care. There are challenges that have come with the range of services that we provide. Obviously, our staff is now stretched. We need more staff, and I'm happy to report that very soon we have more staff to complement our efforts. We are a little also constrained by the numbers. So you see that previously we ran an OPD service. So we did not have to do a ward rounds. We did not have to do surgery. So all doctors were available in the morning to start work ab initio. So the patient waiting times were shorter than. But because of these additional important services, a little bit of drag has been put on the patient waiting time. So we have people having to wait a little longer. However, yes, we are working at improving that. So not all of us go for rounds. A few doctors stay back to clear the backlog. Generally, we have had increased patronage too. So that also compounds the waiting times that we've had. But so far, so good. We are happy to report that we have not disappointed the university community too much in the provision of services. student patronage has been excellent. Prior to this 24-hour care, personal experience is that when you go home, as soon as you drop your bag, and a call is going to come from my very good friend Dr. Tay or Dr. Latifa. We have a student at trauma, we have a student at the municipal hospital who needs some form of special care, and then we have to run around to do that. I'm happy to report that all that is a thing of the past. Yes, a few students still go to the other places, but we are encouraging them to come to us. Yes, we are a small facility, but in terms of service provision, we may not be too different from the sister facilities. In any case, when we need their help, we appropriately request for it. Either bring them here or actually send you there. So student patronage has improved. The challenge with the students is that they don't have the health insurance card, and so sometimes they have to pay for services. But the health insurance card is it's a national requirement. So once we have that cleared, students should not have any challenges coming to us for services. Yes. Regarding first year students, if you read the admission letters we give you, we actually indicate on it that you should come with a valid health insurance card. From next academic year, we'll verify. So when you come and you are putting your inputs into our health management system that we use to run the medical examinations, once your health insurance is not valid, it will not pick it up. So you need to have a valid health insurance card to start with the medical examination process. That becomes your basic biodata for healthcare. For continuing students, we are going to create a special portal for them to upload their ID cards, and then so that when they come to the clinic, we are not going to be asking you for your card. We will ask you for your name, and then we already have this information in the system, and then we encourage them to renew the card. So we are actually aiming at 100% coverage just for the health insurance, just in line with the national policy of universal health coverage. So staff, yes, you know that when you come here without your health insurance, we would ask you to pay, and that's the uncomfortable bit about it. But even the payment for the health insurance is done by the university, so we just need to prompt you to go and get it renewed for services. It is easier on us. It helps the university save some cost. It helps us improve our services. So yes, regarding insurance, this is what we would use to bridge the gaps that are there regarding the coverage. The new hospital is new. Our hospital is nearly complete. Once again, I have to thank the management of the university for that. They are putting all efforts very, very, very soon. I don't want to take the wind out of the sail of the Vice Chancellor. He would probably tell us when it will be ready and be commissioned for us to use. However, in terms of service delivery, we will be conducting our first delivery, the University Health Services. So far, all the other surgical services we have provided has not touched this salient aspect of care. So we would conduct our first delivery at the University Health Services very, very soon. Very, very soon. It is one of our own staff dependent who has reported for a service we can offer that we will be offering this person. The University Health Services belongs to the university community. The university community comprises staff, students, and the surrounding community. Any person who is indeed even beyond the surrounding communities. If they feel that we offer a service that they may benefit from, they are free to come. We have attended to, indeed, of the nearly 90 surgeries we have done, more than 70% are on persons who are not staff and are not students. So yes, if you are out there and you want to come to university clinic, please can bring along your health insurance card. Where we can use it, we will use it. Where you may not be covered for by the insurance regarding the service we provide, we will tell you. We are not going to spring surprises on you, so that you know what to do. Yes. Oh, okay. We encourage the staff to have confidence in the university health services. We are trying to provide the university the best of healthcare in Winneba and even beyond. We will soon get to a situation where, when we don't even have services readily available, instead of sending you on in an ambulance to call it, we will bring the specialist here to take care of you. That's how we value your health in the university, and that's how far we can go to get help for you. A few instances here, I'm sure probably people would have heard. We actually had to bring expertise to come and help us in our emergency setting, instead of putting somebody in an ambulance and sending you somewhere else. Anything we do to help the university community, you can be sure that the University Health Services will do it.